There was a show I used to watch that's called 60 Days In. In the show, there would be 6 to 7 people from the community who volunteered to be sent into prisons as informants. They would report back anything bad they saw happening to the chief, and allegedly it would be fixed. There was something in one episode that disturbed me, though. A lady who had a history of seizures was having one in her cell. Other inmates wanted to help but didn't know how, so they tried getting guards. Nobody showed up, and she was left to have a seizure. Historically, prisoners have not been treated in a way that would benefit their mental or physical health. This is a problem because people cannot get better in situations where they're not given the opportunity to do better. Instead of these inmates spending time in jail to then be released and live a better life, they're reverting back into the same habits while their mental stability is declining. Then they end up back in prison. People incarcerated are abused, neglected, tortured, and on occasions murdered or left to die. Many families have to suffer the loss of a loved one because of these tragic events, and more than likely no justice is served. Instead of dealing with the aftermath of the problem, make sure the problem is less likely to happen to begin with. We can all agree that jails are a place where criminals are held until they are released after an extended period of time, but we can also agree it is not a psychiatric hospital where people who need actual care should be sent to live in neglect. That being said, prisoners should be treated in a way that benefits their mental and physical health because they are not getting treated humanely at these prisons. Their mental health is not being acknowledged or given any further attention. And lastly, prisoner laws and the healthcare that prisons are supposed to be giving is not what they are giving. Starting off with what needs to be covered is the way the prisoners are being treated in general. From research that has been gathered, it is easy to see that they are not being treated as humans, but more as if they are deranged animals. This treatment has been seen multiple times across incarcerated people who have more than likely met the same fate, a drastic mental decline or worse, death. But before death, they are beaten, neglected, harassed, tortured. Considering this, let's just highlight a minuscule amount of the vast number of cases where these tragedies can be seen. A man named Joshua McLemore, who was only 29 years old, had a history of schizophrenia and substance abuse, was a victim of mistreatment from officers, which led to his death. Maintenance workers said McLemore was found confused and naked on his apartment floor where he was taken into a hospital, and court records say he was arrested for pulling a nurse's hair. He was put into solitary confinement, which is where inmates are isolated for 23 hours of the day in a small room, allowed time for brief showers and medical emergencies, but are given no contact with their families. McLemore had to experience 20 days of this and only be allowed a short shower, but in his case, he was strapped down to a chair during his shower. While in that small room, he slept less than an hour every day, spent hours staring into space, laughing, talking, screaming, and was often covered in his own waste, yet he was still neglected. He was barely eating, and when he did, it would be the styrofoam that food was handed to him in. Within 3 weeks of his incarceration, he already lost more than 45 pounds and was unable to move, so finally that was the day that officers took action. But it was too late. Court records state by the time staff finally sent Josh to the hospital, his condition was so dire that the local hospital did not have the clinical resources to treat him, and he had to be airlifted to a larger hospital in Cincinnati, where he died 2 days later. This tragedy could have easily been prevented if they decided to hold McLemore as a priority instead of throwing him to the side and neglecting his health. Not only that, but nobody involved was charged or reprimanded, which leads the officers to thinking they have that type of power to get away with just anything, and it will inevitably lead to an abuse of power. One thing specifically officers use is solitary confinement. NPR.org found that this was first being used at an Eastern penitentiary in Philadelphia. They would place these individuals in solitary confinement with the Bible, hoping they would reflect on their actions and change their ways. Being put into solitary can be for a variety of reasons due to minor infractions, spitting, profanity, disorderly conduct, hanging out of windows, yelling, or trying to harm themselves or somebody else. But ultimately, it is up to the guards whether or not they are put there, meaning someone can be put into solitary for no reason at all. As if being in confinement was not enough, while there, they are restricted from job training, education, or getting any type of treatment that might rehabilitate them. Seeing that it did more harm than good and caused severe psychological effects, they stopped using this practice at the Eastern Penitentiary. As a matter of fact, in 1890, the Supreme Court acknowledged solitary's harmful effects, yet it is still used to this day. In addition to the restrictions while in solitary, There are psychological problems that grow from it, and they experience high rates of recidivism. Recidivism is defined as the tendency of a convicted criminal to reoffend, essentially saying once this inmate is released back into society, they are just going to fall right back into prison again and again. Even people who had no history of a mental condition have been found to be affected by their time in solitary just as much as the mentally ill. According to Fair Fight Initiative, many studies documented the outcomes of being in solitary are hallucinations, paranoia, insomnia, hypersensitivity, lack of emotional regulation, increased suicide risk, and symptoms of post-traumatic stress disorder. Though the prisons are aware of the effects of solitary and the officers' power over it, they still continue to do little to nothing about it. Since mentioning how they are treated physically, we cannot forget the mental aspect of this abuse. These prisoners are mentally affected by this mistreatment, and the majority already have a mental condition. Despite how much help those inmates require, they are commonly denied the access to medication and support they would need to remain stable. For example, the ADCRR has refused medical care and kept people in solitary for up to multiple years. They have had inmates suffering and deaths that had been hidden. But let's see a case that has been brought to the public. John Rudd is a man who was formally diagnosed with schizophrenia and post-traumatic stress disorder, or commonly known as PTSD. He was being held in a federal prison near Hazleton, West Virginia, to be serving 8 months in prison for violation of his probation. When first arriving, guards were aware of his mental issues, yet he was still placed on level 1 care, which level 1 care is for inmates without significant health needs, and it requires inmates to let an officer know if they are not feeling well. Later, things started to worsen for John, and the voices in his head were getting progressively louder. By this time, John had already stopped taking his psychiatric medications, which were to reduce and or temporarily prevent his mental health problems. To suddenly stop taking these medications could lead to worsening symptoms than the individual had even before starting the medicine. That is what John was going through when he told prison guards he had wanted to hang himself. The records say that he was then sent to a suicide watch cell, but while there, John was slamming his head against the wall trying to snap his neck. John was caught and immediately injected with a dose of haloperidol, which is the antipsychotic drug used to help treat schizophrenia and aid in preventing the person from suicide. Despite this from happening, the prison would ultimately still come to the conclusion that John was still not ill enough to require further support. The next day, it was decided that he would be removed from suicide watch and only be fit with level 1 care again. Afterwards, John was put with psychologists, and they claimed it was likely he was pretending his symptoms were worse than they really are. John was diagnosed with schizophrenia and PTSD back in 1992. The psychologist marked his illness as resolved and proceeded to say that he only had antisocial personality disorder. So he remained on care level 1, the lowest care level, until he was released in July 2017. Tammy Seltzer, the director of DC Jail and Prison Advocacy Project, which aims to support former inmates who battle with mental health once they are free from prison. Tammy stated about John's case, Rudd's medical history should have designated him for a higher level of care. A higher classification would have ensured someone was checking in on him. No way should he have been put on level 1 care, ever. After John's release, he got aid from Seltzer's organization, and they helped him get a therapist, got him back on his medication, and later contradicted the prison's reports of him not having any mental illness. While many people worry about the large number of inmates with mental health problems, not many think to turn their attention to how incarceration can really worsen these symptoms. As seen in John Rudd's case, that is a prime example of incarceration putting more stress on an individual, instead of trying to help them. Research shows how bad symptoms get when going to jail or prison vary among individuals, but it still does something to each person that goes through it. Research also shows that the conditions in prisons further add on to the decline of mental stability. With major overcrowding issues, solitary confinement, and the ongoing violence between other inmates, those inmates are being set up to fail. There have been theories of this leading to prisoners developing post-incarceration syndrome. Post-incarceration syndrome is an inmate having a combination of other illnesses such as PTSD, antisocial personality traits, social sensory deprivation issues, and substance abuses. As stated in the first paragraph, the way that these inmates are treated physically can take a huge toll on them mentally. If you are constantly treated like you were nothing more than a liability or meaningless, it can make you feel exactly like that. And in no way is that going to help you feel better mentally. Seeing this from the prisoner's point of view is the most important thing because it builds an understanding. Prisons need to understand that there is a large amount of research and data made to show that how they're treating these people is the worst route you could possibly take. Finally, the last concern to be mentioned is the violations of prisoner rights and the health care they are supposed to be receiving. First is prisoner laws, specifically under the circumstance that an inmate experiences assault or excessive force. One of the first things is prison officials have a legal duty under the 8th Amendment of the Constitution to refrain from using excessive force and protecting prisoners from assault by other prisoners. If you don't know the 8th Amendment, it states, excessive bail shall not be required, nor excessive fines imposed, nor cruel and unusual punishments inflicted. The main thing to focus on from that is a restriction against cruel and unusual punishment, which can be anything that goes against social decency standards, or one that causes excessive pain, is any form of torture, or is degrading and humiliating. The second thing is officers may not use force maliciously or sadistically with intent to cause harm, but they may use force in good faith to keep order. For example, if somebody is harming themselves, then it would be appropriate to use force to stop that from happening and letting further damage occur. Lastly, it states prison officials may be violating the 8th Amendment if they knew about a risk of assault by other prisoners but failed to respond, or if prison conditions or practices create an unreasonable risk of assault. Meaning, if there is a malfunction with the lockdown on the cell doors, or if there are not enough guards in the units, that is intentional disregard for prisoners' safety if something leads to violence. After stating the prisoners' laws against violence toward them, there are remedies what to do if that happens. They are allowed to file grievances against the officer who mistreated them, but it must be immediate because of strict time limits. The time limits are not specified, so it is easy for that to get abused by officers. Then if an inmate believes they are in immediate danger of being harmed, they are allowed to notify a trusting staff member, such as teachers, mental health workers, counselors, etc. That also comes with flaws because there is not always a trusting staff member that an inmate might be aware about. To add on to that, according to the Marshall Project, in federal prisons they were low on staff so severely that the Bureau had to use counselors as correction officers. The situation began to worsen after the Trump administration put in action a hiring freeze to cut spending. However, despite what information is being presented about this issue, there will be people who do not agree with it. Some people might say that the inmates could fake their symptoms into getting a specific type of medication that could be used for drugs, which is a common occurrence. It is also a possibility of people who do have a mental illness to sell their medication in prisons for contraband, which leads to their worsening symptoms and being violent. To cover prisoners faking their symptoms, it is not hard to run a test to see if an inmate actually has the illness that they're claiming to have. Furthermore, since they are around professionals who are aware of actual people with these illnesses, it should be easy to figure out who's faking it. For inmates who have been legally diagnosed mentally ill and decide to sell their medication, first step is making the inmate take the medication while in front of a guard to make sure it is consumed, avoiding cheeking, which is the act of putting the medication on the inside of the mouth on your cheek and not swallowing it. One of the ways they can prevent this is by making the inmate eat or drink something with the pill and let them sit for 20 to 25 minutes. To conclude this, these are the reasons why the prison system is failing when it comes to dealing with the mentally ill. The guards do not treat the inmates as people who need actual help and abuse them. They not only abuse the prisoners, but when they see there is not much or any consequence, they abuse their power over them. Furthermore, the inmates' mental stability is not close to being a priority for the prisons. They would much rather write them up, throw them in solitary, and ignore them while they rot away. Lastly, the health care and treatment prisoners are supposed to receive is not what is being given, and their laws are being violated. Some inmates most likely do not even know that they have these laws with them, but it does not make it any better. The guards constantly violate them. Thank you.
Great job, Onyce. We'll now get started with question.
Thank you, Maya. That's a very important issue, and I appreciate you bringing that to our attention. So my question for you is, in your research, did you find any prisons which were trying to do anything to address the mental health needs of their prisoners? And if so, what have they tried and how effective has it been?
No, I didn't find any specific prisons, but like I did hear that they did have counselors and stuff. They would train other prisoners to be like listeners, to be like specifically to listen to the other prisoners' problems so they can help them.
Great. And do you have any ideas on what prisons and governments can do to better address the mental health issues of their prisoners?
I feel like maybe enforce what they're saying and actually like keep on top of what they're trying to do. Cause like they have all this stuff down, what they expect them to do, but they're not holding the guards or chiefs to those expectations.
Onyce, great job. Your thesis discusses the reliance on medications like haloperidol. Considering the complexities of mental health care, especially within prisons, what is your perspective on the balance between medication and other forms of treatment? So medication versus any other type of treatment that somebody could receive for mental health.
Like which one is better?
Just what's your perspective on it? How do you feel about, medication versus other forms of treatment, or that they should be used in conjunction with one another? And if so, how would that look in prison?
Well, mainly I just feel like they should be doing what they're supposed to do. Because they're supposed to give them their medications if they're like legally diagnosed. And like in my paper, those people weren't like legally diagnosed and they weren't giving them their medications that they were supposed to have. So I feel like just giving them their medications should help also. Then they have the counselors so they can talk to them also. So like both things.
Good job.
Thank you.
Maya, in your paper, you mentioned, not Maya, I'm so sorry. I think I heard that I already regurgitated it. Onyce Thompson, in your paper, you mentioned excessive force. You mentioned failing, like prison system failing, excessive force. As I thought about what you were saying, I don't know if you saw at all that there is a issue now with correctional officers committing suicide that are working inside the jails. Like they're really having an issue with them having good mental health themselves. The correctional officers who are supposed to be taking care of persons in prisons with mental illnesses. So I wanted to ask you, with both of those things going on at the same time, mental illness and then the correctional officers also having problems as well, what are some things you think that can happen, some preventative care measures for persons who have mental health issues before they go to prison, before they go to jail, that can happen, that can help them so they don't land in jail? Some preventative health measures, some preventative things that they can embrace or take part in so that they don't end up in prison. Maybe some things the country can do, maybe some things you feel like you would like to do, but some preventative things that would help them not to have to go to prison.
Like if they were to go to rehabilitation, like that, or like.
It could be that. I just wanted to give you an opportunity to respond. It could be anything from seeking out different health insurance. It could be education. But some of the things you think that they could do potentially so that they wouldn't end up in prison if they have mental health illnesses. Because people realize and get those things or diagnosed sometimes in high school, sometimes in earlier than that. But some of the things that they could do, or even our country could do, to help those persons so they don't go to prison.
Well, I feel like individually, like a way, like I'm trying to think about individually, like talking to someone, maybe, trying to think how I want to word it.
Every time.
Like they could talk to someone, but at the same time, not everyone always wants to talk to someone when they're having problems. So even just having people who do check up on them.